my name is Sarah. I'm a first semester nursing student, and I'm one of the girls that worked on this poster presentation about family connection. We did an article research narrow down. We used some online resources, and we took advantage of one of the librarians who knows what he's doing as far as research articles. And we really wanted to focus our family connection on connection within the family and not so much about how a nurse connects with the family. So it was kind of hard to find articles, but using the librarian Paul Weiss, we did end up finding some, and I was pretty happy with the result that we got. So what we did is we compared a connected family versus a disconnected family, or we did that multiple times using several articles, so we could really compare the two types and see what makes a connected family so connected. Through our research, we did find that if you have a more connected family, the ill member feels like they have more of a social support system and they will have better health outcomes. So with the connected family, it can be things such as they communicate well, there's negotiation among members. The ill person feels that it's more of a we experience than an I experience. They don't feel like they're going through it alone. And in one article, we found that extended family really came in and helped take care of the things that were normally being done by parents or by children, so they were able to adapt to the role changes. In a disconnected family, you would see things more like avoidance or lack of communication or inability to adapt to the role change. So one of the big things we noticed with avoidance was we read a book in our class called Still Alice about a woman who's diagnosed with early onset dementia, and her husband really has a hard time with her diagnosis, and he struggles a lot, and he just avoids Alice and he avoids the topic, and that was really hard on Alice and her family. So we used that as an example. We also talked about marriages that get disconnected, specifically by traumatic brain injuries or having a child with cancer, and that was, their connection got tested mainly by lack of communication and unwilling to communicate openly with each other. So some recommendations that we have for nursing practice are, as a nurse, just to encourage open communication within the family. With the marital examples, if you really see a couple struggling, it might be good to suggest that they find some formal resources such as marital counseling, and just to help families find ways to deal with their stress healthily. And then we were just left with a few questions after all our research. Are the traits of a connected family different amongst different cultures? Are there any universal tools that really assess how a family is connected? Because we found that in a lot of the articles, they just interviewed family members, and we wondered if there was a different kind of tool that could really assess how well a family is connected. And then we also wanted to know how families can learn to communicate during a crisis. If they start to get disconnected, how is there a way as a nurse that we can reconnect them with each other? So that was our project.